Hi all, welcome back. This is our 6th mini lecture for male reproductive system. We are going to be moving out of the testes and following the pathway that sperm will take from their site of production in the seminiferous tubules to outside of the body. What an exciting journey we're about to go on. All right, so we did leave off talking about sort of the histology of the testes and looking at the seminiferous tubules and where they're located. Now what we want to do is just wrap up what's going on in the testes and then start looking at the pathway that we're going to follow if we're a sperm from the site of production into the big world. So for the testes, right, we are going to, still internal to the testes, we have our seminiferous tubules, and then we sort of have our collecting structures. The major one is going to be the rete testis, so this is where all of those sperm that are being produced by the seminiferous tubules are going to pool. So they're going to get pushed out of the seminiferous tubules and up towards the rete testis. I think now is a good time to point out that at this point the sperm are still immature. So they are not swimming. They are not using their flagella and their tails to sort of whip around and get from one place to another. And in fact, we wouldn't want them to be. So we wouldn't want them to be wasting their energy moving around in the male reproductive system when they really need that energy to move around in the female reproductive system. So at this point, the sperm are actually just going to get passively pushed from the seminiferous tubules up into the rete testis, and so they will flow simply with fluid, right? Fluid sort of going to wash them towards that rete testis area. That rete testis is still in the testes. It's not until we get into the efferent ductiles, so these tubes that are going to lead us to the epididymis, that the sperm are actually leaving the testis. Now we do have a testicular artery. The testicular artery, we have one that goes to each of the testes. It arises from the abdominal aorta, passes down through the posterior abdominal wall, through the inguinal canal and into the scrotum. So we can see it comes in sort of as part of the spermatic cord. So it does have to go through that inguinal canal to get to the testis. It tends to carry oxygen poor blood, so the blood that it's bringing in isn't terribly oxygen rich anymore, and there's sort of a number of reasons that this is theorized to happen this way. In addition to not having a lot of blood pressure, not having a lot of oxygen, our sperm are actually going to develop really, really big mitochondria. So we know that they're going to need mitochondria to power their movements once they're in the female reproductive system. But sort of the question is how are these two things related, right? How is poor oxygen supply in the testes related to development of the large mitochondria? And so one idea that's been put forward is the poor oxygen may actually sort of precondition the sperm for survival in a fairly unfriendly vaginal environment. So the female reproductive system is known to be pretty hostile to sperm, and so if they are not going to have a lot of oxygen in the female reproductive system, maybe sort of starting their life with little oxygen makes sense, because then they're already used to that and it's not a huge change for them. So that's sort of one idea of why this may exist. I already mentioned the pampiniform plexus, but this is going to be the testicular veins that are going to carry oxygen back out of the testes. So there's that. We do also have lymphatic vessels that are going to drain each testis, and we have testicular nerves. They are sensory and motor, and they're mostly part of the sympathetic nervous system. Okay, so now we're going to start on our pathway from the testes to the urethra. So these are going to be our spermatic ducts. Directly out of the testis, the first structure that the sperm are going to enter are the efferent ductals. So the efferent ductals, there's usually about 12 of them. We can see them coming off the posterior side of the testis here. They're sort of these straight tubes that lead directly into the epididymis. The epididymis is a very, very long coiled tube. So if you were to uncoil the epididymis, it's like 6 meters long. So it's incredibly long. It's just this very, very tightly coiled, very narrow tube. Again, it wraps sort of over the posterior superior, posterior side of the testis, so over the top and around the back. We do divide it into a head region, and then along the posterior side of the testis would be the body. Down at the very end where it gets really narrow and then it makes a 180-degree turn is going to be the tail. Its job is varied. So one thing that it does is it actually holds on to the testes for a while, so they mature here and they can be stored here. So in between ejaculates, if it's the sperm aren't ejaculated, they are going to spend more time in the epididymis, so they have time for maturation and storage. A sperm, it takes about 20 days for a sperm to go from the head and then work its way all the way through to the tail of the epididymis. That's going to be this time during which we have maturation. After that point, they do remain fertile for 40 to 60 days. So they can be stored there for a month to 2 months before they are going to sort of break down and not be fertile anymore. If they stay in the epididymis and they are not ejaculated and they are no longer fertile, so let's say they've been in there for 90 days, they will disintegrate and be reabsorbed, and we'll use those parts again to make potentially new sperm sort of later on. One other thing that I don't think I have listed on here is that the epididymis is going to absorb a ton of the fluid that's coming from the testes. So in addition to sperm coming through the seminiferous tubules, they're going to be carried in like a tidal wave of fluid. So the fluid sort of is used to sort of push them from place to place. In the epididymis, 90% of that fluid is going to be absorbed. So we absorb most of the fluid, sort of concentrate it down so it's more sperm and less fluid as it moves through the epididymis. From the epididymis, the sperm are then going to move into the vas deferens. So the vas deferens is a muscular tube. It's not convoluted and twisty-turny. It's pretty much just a straight tube. Again, you may know it as the vas deferens, is how it has been previously referred to. So it comes off of the tail of the epididymis, moves up through the inguinal canal in front of the pubis, and then over the urinary bladder into the posterior side where it forms this swelling. So this, swelling, ampulla. So this is its pathway. And remember from what I said in the last lecture is that we have basically one tube carrying fluid draining here, and then we have the seminal vesicle, which is going to drain into the same point. So it unites with the structure that comes off of the seminal vesicle, and both of those are going to secrete their products into the ejaculatory duct. There's not really a ton to say about the ductus deferens. It's a tube that carries stuff from one place to another. It does have a fairly narrow lumen still. It does contain quite a bit of smooth muscle. And again, I'll point out that we have innervation by the sympathetic nervous system. So keep that in mind. Why might it be interesting that so far the structures that we've talked about have largely been, so the testes and the ductus deferens have largely been innervated by sympathetic nerve fibers as opposed to maybe parasympathetic nerve fibers. Okay, so from the ductus deferens, all of the contents are going to be dumped into the ejaculatory duct. So the ejaculatory duct is very short. It's only about 2 centimeters in length. It is our last spermatic duct. So after this point, we are going to put everything into the urethra, and it is on its way out of the body. We are done. We're not messing around at this point. So the ductus deferens and the seminal vesicles are going to merge together, and we can see this is the posterior side of the urinary bladder. The sperm are going to come from the ductus deferens. Here's that seminal vesicle. It's going to empty its fluid into this ejaculatory duct, which is just very, very short and opens directly into the urethra. The ejaculatory duct does pass through the prostate. Okay, so this is going to be our first introduction to this prostate, which is sort of this acorn looking like structure sort of wrapped around these different tubes. So looking at the urethra, we have seen the urethra before, so I'm not going to spend a ton of time talking about it, but it is shared between the reproductive and the urinary system. Fortunately, it cannot be used for both at once, so it is either passing urine or passing semen, but it is not passing both at the same time. Okay, so it is either exclusively being used for the reproductive system right now or exclusively being used for the urinary system, but they cannot happen simultaneously. It is long. We do divide it into our 3 segments, which we already know at this point. So we have our prosthetic urethra, we have our membranous urethra, and then we have our spongy urethra. Prosthetic is going to be associated with the prostate. Membranous is just very short. It's basically the region between the prostate and the penis. And then spongy is going to be associated with the penis as the tube moves through each of those structures. So from the urinary bladder, through the prostate, membranous urethra, and then spongy urethra. All right, so as we move from place to place, you may have noticed that there are a few structures we haven't talked about yet. We've talked about the testes, we've talked about all the spermatic ducts that lead or carry the sperm from one place to another, but we also mentioned the words seminal vesicle and prostate, and I didn't say them, but the bulbourethral glands are also going to be part of this system. So those 3 are going to be our accessory glands. We can start with our seminal vesicles. So seminal vesicles are paired, which means that there are 2 of them. They are going to be located on the posterior side of the urinary bladder. There's essentially one associated with each of the ductus deferens coming from the right testis or left testis. I had to think about that. They are going to, like I've said multiple times now, empty into the ejaculatory duct. And what they do is they form about 60% of the semen. So when we look structurally at the seminal vesicles, we'll notice that we have a connective tissue capsule and smooth muscle. And then inside, we sort of have this convoluted duct work, right? So we've got some branches. It forms almost like this labyrinth. We are going to be producing fluid that makes up a large part of the semen in the seminal vesicles. So that's going to be about 60% of the semen. What's coming in from the ductus deferens is going to be about 10% of the semen. And so that leaves us 30% of the semen, which comes from the prostate gland. The prostate gland is singular, which means that there is just one. So we have 2 seminal vesicles, we have 1 prostate gland, and we'll see in a second here we have 2 bulbourethral glands, but we have just 1 prostate. So the prostate is going to be 30 to 50 compound tubuloacinar glands, which are going to produce, again, a fluid and then empty into the urethra. So there's all sorts of little pores in here going to empty that fluid into the urethra. Here we have a thin milky secretion that's 30%. So again, 60% of the semen comes from seminal vesicles, 30% comes from the prostate, 10% comes from the testes, and that gives us what makes up semen. Now, the last of our accessory glands are the bulbourethral glands. So the bulbourethral glands are pretty small. They are paired. So here's one here, and there's one there. We can see they're on either side of the penis, sort of near the base. Whoops. Actually, I want to erase that so we can see them better. There we go. So they're sort of on the base. They're real tiny and they don't secrete a ton of fluid. They also do not secrete fluid that is part of semen. So they don't actually add volume to the semen. The fluid that they produce is going to be produced prior to ejaculation. It's fairly early on in the arousal phase. They're going to secrete a sort of slippery fluid that has 2 major purposes. One is essentially to clean out the urethra. So any urine residue that's in the urethra is going to be acidic and it's going to be hostile to sperm. So we have the bulbourethral glands, which secrete a nice sort of slick fluid that cleans that out. And then the second piece is going to be essentially lubrication. So it lubricates and it cleans out the urethra. All right, so I am at 15 minutes now, so I'm actually going to stop. I will come back to discussion of the penis, and then we'll move into production of sperm, so the physiology of the male reproductive system in our next mini lecture.